Patient preparation includes obtaining a history, telling the patient what you're going to have them do, demonstrating to the patient how they're supposed to perform the test, and an enthusiastic coaching from the technician. As mentioned earlier, this is an unnatural act. People do not normally inhale maximally and then blast all their air out as they breathe. The technique needs to be demonstrated so that they understand exactly what you're expecting of them. As you tell the patient to take in a deep breath, be sure you take in a deep breath yourself so that the patient can see that that's an important part. Tell them to open their mouth and place the mouthpiece between their teeth. As you do that, open your mouth and place the mouthpiece in there for them to watch. And then finally, when you tell them to blast out, be sure that you yourself are showing them how to blast out. It's not a passive test that you're doing. It's a very active test, and they need to understand that. As you're giving the demonstration, be sure to use a mouthpiece yourself so that the patient can actually see the entire process of opening their mouth, placing the mouthpiece between their teeth, and then closing their lips tightly, sealing around it, and blasting out all at once. In this video, you'll be able to watch the technician as she asks questions relevant to the patient's history. These questions include smoking history, exposure to dust or chemicals, and anything else that's appropriate for the patient population that you're dealing with.
Okay. Do you now, or have you ever smoked cigarettes?
No.
No? Okay. Do you have a cough or wheezing or chest tightness?
Yes.
Yes? If you have a cough, do you bring up mucus with that cough?
Sometimes.
Sometimes? Okay. Have you ever been exposed to fumes that may affect your lungs?
Yes.
Yes. And you're male. And how old are you?
34.
34. We're going to stand up right here and check your height.
Notice that the patient height is actually being measured, since many people overestimate their height. That will also overestimate their predicted values and may falsely classify them as having lung disease when they do not. This can be done with something as simple as a ruler attached to a wall.